Welcome to another installment of our 2020 Virtual Global and Community Engagement Conference, formerly known as D80. The conference is a dialogue and celebration of our efforts to solve issues that confront the world's poorest 80%. Traditionally, it's a one-day conference featuring multiple in-person panels and breakout sessions. This year, the conference is being delivered virtually throughout the entire month of October, including a lecture series, a rosé gallery exhibit, a walking tour, and a series of online interviews with local and global change makers throughout the Michigan Tech community. My name is Thomas, and I'm a member of the Conference Planning Committee. Today, I have the pleasure of interviewing Christopher Morgan and Robin Meneguzzo. Will you please to introduce yourselves and tell everyone a little bit about what you do?
Sure, Robin, why don't you go first?
So I'm Robin Meneghuzzo. I'm a family nurse practitioner. I've worked in our community, the local community here, for about the last 5 years as a nurse practitioner, and prior to that as a nurse. And I currently actually am working at the Western Upper Peninsula Health Department, mostly doing COVID response work in our communities and over our 5 counties that we serve. And I also do family planning there too. So I still do have a clinical job there as well. So that's my kind of day job. And then I've been working on a project as well, kind of on the side. So that's kind of a little bit about where I'm at currently. And then we'll get into talking about the project too.
And I am Christopher Morgan, as you mentioned. I work in the Enterprise Program Office here at Michigan Tech, specifically focused on coordinating student projects with some of the corporate, industrial, and not-for-profit sponsors that regularly interact with our students on specific projects. And of course, that's what brings me here for this specific project today. We are talking about a coordination of a project with one enterprise team, the IT Oxygen team, with the Western Upper Peninsula Health Department, specifically for a web resource for citizens of our community to be able to understand specific opportunities and health resources in the community.
Awesome. Thank you both. So the first question I have to you, Christopher, you already kind of touched on it, but would you both just taking a few minutes to dive more into the collaboration between the IT Oxygen Enterprise and the Western UP Health Department, and maybe just talk a little bit about how that collaboration got started in the first place?
Yeah, maybe I'll start since we kind of started and then brought Chris in. So myself and Dr. Kelly Kam, she's a professor in she's a trained epidemiologist and has a special interest and focus in rural health. Her and I connected, I would say, early in the beginning of 2020, just working on actually another project. And we started to talk about our interest in rural health and how our community is really in need of centralized resource, a place where people can get that information and that's accurate, that's up to date, and preferably digital, because everything that's print would be out of date by the time it's printed. And so Kelly had been instrumental in compiling the statistics that were put together for 2018 Community Health Needs Assessment that the Western Upper Peninsula is required to do every 2 years. And so when Kelly was compiling that data, one of the priorities that were identified was that we needed a centralized place for up-to-date information that would address social determinants of health. And those are things like, food access and medical access, and things like, childcare, or where can, mothers who need support, or things that really affect people's health, but aren't necessarily just directly related to what they would receive in a medical office. And so when Kelly and I started that conversation, we just started to kind of brainstorm how we could potentially bring this to life and what that might look like. And as that conversation evolved, Kelly thought, potentially the enterprise team might really be something that could help us actually build the technology. And so then we met with Chris and kind of started this collaboration and conversation.
Yeah, perfect. Thanks, Robin. And really, the basis for this specific project is agreeably right in line with the fundamentals of the enterprise program. Specifically, there are technical tasks that have to be accomplished, including the development of the web resource itself, right? That's going to take some significant input from some of our computer science and computer and software engineering folks in the enterprise program. So we really feel strongly about the tie-in from the technical perspective, and then also, of course, there's a community element of engagement here for the students, and really we find that the students who are involved in the program really appreciate opportunities to give back to the community, and this is obviously a specific example of that, right? So the IT Oxygen team and their advisors are, of course, very excited to get started. They're hoping for a smooth transition into this project starting in the spring semester, and we're, of course, excited to see it happen.
Thank you both for the thoughtful answers. I have a couple follow-up questions. First, for you, Chris, how many people are in the IT Oxygen enterprise right now?
That is a great question. I think it's about 15 to 20 students total. Typically, we have anywhere from 3 to 5, maybe 6 students assigned to any specific project on the team at any given time. Okay,
awesome. And what have some of the prior projects been, just briefly with the IT Oxygen enterprise? Is this going to be a rapid change or crossover?
I don't think it will be too much of a difference of some of the projects that they've worked on in the past. They've done everything from database type projects to big data management projects. They're currently working on a couple projects actually for local sponsors or partners of the program. One of them is a local health business here in Houghton, actually, and they are specifically looking for a very similar type website design that is currently being executed and planned for a December of 2020. So this coming next month, I guess, finish. Lots of different projects, everything from the automotive industry to health informatics, and everything you can imagine in between. So the team itself, I think, is about 20 years old, and so they've had a lot of different students and progressions throughout the years and different experiences. I can imagine they've had probably 50 to 75 different projects over the course of their history. The advisors themselves are fairly new. We just had a transition on the team, and so Dr. Walker and Dr. Hattie from the Electrical and Computer Engineering Department are definitely ready to take on this specific project, and some of their previous industry experience, I think, will help as well.
Thank you. And then, Robin, I had a couple questions for you as well. In terms of social determinants of health, what does this collaboration mean, especially in this current time frame, just with everything that's been happening with COVID-19?
Yeah, so it's interesting because this conversation started before the pandemic. And what happened in March is I actually started to work in our outpatient COVID testing and clinic. Although we didn't have a lot of cases up here, we still had to function in that way, right? And one day I had this woman who was like 76 years old who lived alone, who I was putting into a 14-day quarantine. And I realized that she didn't have, who was going to bring her groceries, and, did her heat work, and did she have, the supports that she needed to be isolated in her home for 14 days. And it dawned on me that this whole bright idea that Kelly and I were cooking up was like absolutely 100% needed right now. And so what Kelly and I actually did was we mobilized a volunteer group of students, and I want to give Kelly most of the credit for this, but we worked together to just pan out across 5 counties and figure out what resources we had. We compiled them into this just laundry list, and they live on the coppercountrystrong.com website, which was erected by the Portage Health Foundation, and they allowed us to work with their team just to get the information up. So that way, this desperately needed information for a lot of people could be accessed. And at that point, I think you guys can remember, things were changing so rapidly. What services were there? What were closed? What could people access? When places were closing their doors, how did people still get these absolutely essential services? And so that was kind of our grassroots effort to create this project. And so that is like kind of the beginning of where now we want to take this, where we want it to be something that's accessible. We want it to be easy for people, and we're hoping to make it a web-based platform, but also an app feature. So that way people could search easily for what they're looking for. They'd know what county, are they eligible? And so it just really highlighted the importance of that need for me, just in that moment of this woman going home and not knowing if she had resources. So that was kind of the real point that became to be known. And then it came on, and even though we've opened things, there's still a lot of services that are not functioning the same way. So it continues to be an extremely important need for us, pandemic or no pandemic, but certainly more in the pandemic world that we're in now.
Yeah, certainly. I guess I didn't realize that there would be a lot of longevity coming out of this collaboration. Looking long term, this will be able to be refined. Correct me if I'm wrong, but I'm sure that it'll be an ongoing project likely be an ongoing project for the enterprise team. Robin, would you be willing to touch just a little bit more? A lot of what you said about resources being available for people that need them. That's kind of an issue, no matter where you are, really around the world. But especially being in such a rural area, what other obstacles have you experienced or noticed through your practice, or just working with the health department, that kind of gives more light into the new collaboration?
Yeah, I think one of the hard things is that, so working as a clinician is just driver for me to want to do this work and look into it, because what I would see is a lot of these types of problems strongly affecting the health of our community, and therefore overloading the ability of our health system to handle the weight. And it's easy for people who live in urban areas, because easier, I should say, not easy, but easier to get into a specialist that's maybe 45 minutes from them. I have patients that if they've got a type of insurance, the only option they might have is to go downstate to the University of Michigan. And for someone who might not have a vehicle or a driver's license, or the money to pay for gas to get to a doctor's appointment in Ann Arbor from Calumet is an extremely overwhelming hurdle for them to overcome, just to get basic health needs that they need met. And because we are so far from so many different subspecialties, that becomes a huge hurdle. And so we might not be able to bring those medical specialists here, but what we can work on is, how do we hook them up with gas to get there? How do we work with getting them resources to get there? And as a clinician, I had a patient once whose electricity was cut off, but she survived on nebulizer treatment. And I had to intervene to try to get something figured out for her to get that service. And that, and of course that is my responsibility in some parts, but also the support networks that would help with those things, I didn't feel I had at my fingertips. And so what I want is that clinicians or people in the community or people in other nonprofit organizations have a local or one centralized place that they can go and they can find the information quickly and get people hooked up with the right things. So mine is really driven from a lot of things that I've seen over the years that have really opened my eyes to a lot of the holes that we have not really filled well in our communities. And especially now working at the health department, we cover 5 counties, Kuna, Houghton, Baraga, Ontonagon, and Gogebic. It can take us over 2 hours to get to the other side of our jurisdiction. And that's how far people are traveling for certain resources. And so when you start to really see that on a daily basis, the struggle that people face just being in this location of being rural, it really opens your eyes to the need to really use technology to its capacity, and I think that's kind of what we're doing, why we're saying, these students at Tech have this ability to build it. If we give them the resources and the information, this could be a very powerful thing that we could help, improve lives in these communities.
Thank you. Thanks for the thoughtful response. It's definitely really interesting to me see that you've taken what you see in clinic and you're able to reflect on that and then go forth with further action, especially to collaborating with Chris and the enterprise team. It's really cool. I'm going to move on to our next question, and I think both of you have already touched on it a good amount, but how does this collaboration connect with the mission of the Global Community and Engagement Conference? And just as a reminder, the conference is a dialogue and celebration of efforts to solve issues that confront the world's poorest 80%.
Yeah, I think a lot of what Robin already touched on does answer this question, right? So I think, this conference has a long history of talking about some of these major issues, whether they be health issues. Last year, we talked a lot about energy issues. We talked about sustainability in some of the initiatives that have been tackled in the past. And really, I think it essentially comes down to the effort to aid the community here, right? The effort to assist some of the unfortunate people who are in that maybe bottom 80% of our local community here, right? And so I think some of that is pretty obvious. Robin, did you have anything you wanted to add?
No, I mean, I think that, and it's interesting because even up here, even with resources, it can be challenging, right? So even if you're not in that lower 80%, it can be a huge challenge to gain certain resources up here. And one that comes to mind absolutely is actually psychiatric care or mental health care. Even it actually is harder if you have private insurance to get that type of care in the Upper Peninsula, which is, an interesting actually opposite to what we're typically seeing. And so I do think that for me, it's the health of all levels of our community. This is going to be helpful for, and that overall improves the health, I believe. And I think that then drives, a lot of progress actually in an area that, really is sometimes kind of because geographically we are so far from other places, so I think that is one of the reasons this certainly meets that kind of project ideal that you guys are looking to explore.
Thank you. Yeah, I think a key word that I've heard multiple times from both of you is community, and I think that is just incredibly special. It's going to be cool to see how everyone in the area will be impacted in a positive way by this project. So the next question is, how did you get involved with this work, and how has it impacted you personally and the communities you serve? And correct me if I'm wrong, but this project is going to start in the spring, right? I guess I'll start with you, Chris. Do you just want to touch in a little bit, just in general, about how you got involved with the enterprise program? Because my understanding is that you work with all the enterprise teams, correct?
That's right. Yeah. So, my background, I'm an automotive engineer. I spent the better part of a decade working in the Detroit area for one of the major automakers. And actually, I'm an alum from Michigan Tech who was in the enterprise program when I was here in school. And so, and to be honest, a lot of my career decisions kind of spawned from the fact that I was in an enterprise that was automotive focused. It really prepared me for my career. It got me my first set of interviews, right? And so I've always, felt that the program itself is an absolute great and amazing opportunity for students at Michigan Tech to start to explore their career options through their academic process while they're here on campus, right? And so when I came back to Michigan Tech, I came back as a research staff member who was still dedicated to the automotive industry and energy. But when this opportunity came along to join the enterprise program, I thought it was a natural fit for some of my passions for the outcomes of our students, specifically their ability to be prepared for their upcoming careers through some of these what I'll call hands-on or real-world projects.
Yeah, and certainly that has a large impact for giving students the opportunity to really get hands-on involvement in their discipline. And also you work with multiple different, I think you said nonprofits and just different companies and stuff like that. So that's really cool. What has it been like for you to have a lot of different opportunities for the enterprise teams to engage with COVID-19 related issues?
Yeah, that's a great question. And you actually mentioned before that I am responsible for all of the enterprise teams as well as most of the senior design programs here on campus in terms of identifying or helping at least to identify projects, especially the externally partnered projects. And this year, that was a little bit difficult, to be honest, because a lot of the external partners that we normally work with were dramatically impacted from COVID-19. So we had kind of this negative impact on the number of projects that we would normally have because of that. But we also had this opportunity, on the other hand, to potentially use some of our student brain power and student capabilities to help impact and improve the lives of people living in what I'll call the COVID-19 era. Right. So we came up with the enterprise program itself came up with probably 9 different projects related to everything from engineering to design to social design projects that we felt that enterprise teams, we've got 25 enterprise teams now, any of the 25 enterprise teams could have tackled. And we actually created an online, I guess we could call it like a poll that we allowed some of our alumni and current students to engage in to determine which of these 9 projects should get priority in potential funding from donors in order to execute them. And so we picked a couple of them. They're in progress right now. One of them, one of my favorites at least, is being done by the Consumer Products Enterprise. They're dedicated to making 2 different systems related to HVAC improvements that are actually going to be able to capture virus particles and unhealthy things in the air and refresh the air fast enough so that if you walk into a room, there's a reduced likelihood that you might catch something like COVID-19, right? So the purpose of that project is to create essentially an open source system that somebody who owns a shop could literally buy off the shelf, stick it in their room, in their storefront, for example, and potentially make the world a little safer for them. I mentioned there's 2 applications. One is this standalone unit that somebody could buy off the shelf. And then the second one is more of an industrial application for large, big buildings, like the campus buildings, for example, very, very large HVAC systems that keep the air maintained in terms of temperature, but then also in terms of air quality. Those don't perform to the same level as typical hospitals, right? And so we're investigating at the same time how to actually improve the air quality in larger industrial buildings without necessarily impacting the performance of the HVAC systems and dramatically increasing the cost of the system too.
Wow, there's a lot there. Even just within this little niche of COVID-19 related enterprise projects, the variability is really cool. I'll have to go take a look at the other ideas that were generated as well.
Yeah, they're all available on the enterprise website. Thanks for asking.
Yeah. And then Robin, I'm gonna ask you the same question, though I do think you briefly touched on it. How did you get involved with this work, and how has it impacted you personally and the community that you serve? I know you kind of touched a little bit about what it's like to be in clinic and take what you see and then try to make some change for the community.
Yeah, I mean, I think this is my community. I'm from this community. My family is from this community. So I think that I come at it with potentially a little bit more of a connection, perhaps. I think that, like I said, a lot of what I was seeing was really difficult, and people, I would say, I can't believe it's this way, and people would say, well, that's just the system, and my question would always be like, but is it? Does it have to be? Why is it that we can't say, well, that doesn't make sense, let's see what we can do, right? And so that whole idea of like status quo, that we cannot take active steps to try to improve where we are and where things, and that's what progress is, right? And so I think that that piece for me really drove me literally into Kelly's office uninvited. I basically said, please, can I meet with you? I really think that you offer something to this community that we perhaps have not had. And I think that if we get the right pieces together, we can actually, do something. And there's no shame in trying to do something, even, and learning from that and continuing to grow. So, I think that that's kind of what drove me. And I think that, when you see the suffering of other human beings that are your neighbors, I think that for me, it drives me to have to do something, to not allow just to be beat down that this is the way it is, and perhaps at some point, yes, there are things outside of my control, but perhaps this is something that isn't. And so that's basically why, we're kind of just doing this all on the side right now, hoping to kind of make this go. And like Chris said, we finally have the kind of go to start in the springs, which is really exciting. So I'm really excited to kind of see where we take it. And I think we have the passion and the energy behind it really to see it through. So that's kind of why I'm here.
Yeah, it's a really, really cool collaboration. I honestly didn't know a lot about it before starting this conversation, so I'm happy to learn more about it. So I understand that this is starting in the spring, but what has correspondence been like so far? Or is there a rough plan of just how communication is going to work, getting feedback on how the website, web service is coming along, and are there going to be any different sort of prototypes or anything like that?
Yeah, that's another great question. So the enterprise program has historically followed what I'll call a design, build, test type mentality when it comes to any design project, whether we're building something on a hardware, creating a website, or whatever it may be, right? And so something else that we also ask is that the students who participate in the program regularly interact with the sponsoring parties. In this case, the program is sponsored by an external entity, but the real customers, I think, are the Western Upper Peninsula Health Department and the citizens of our community, right? And so the students are going to regularly interact with Robin and Kelly Cam and make sure that their professional view on exactly what the outcomes of the project should be is taken into first priority, right? So those, we expect, I think, those interactions to happen regularly. The students will create their own timeline in terms of what it's going to take to create what your words, right? The first prototype of the design of the website. A lot of the content is going to have to come from some of the community experts, including Robin and Kelly, and specifically some of that content will be created in order to maximize the benefit from the community. Once that prototype is created, the students are planning to do real world tests to make sure that this web interface is actually usable from anybody's point of view, right? A lot of the people that are potentially impacted in a negative way from not having this information might be also less likely to be able to use a website, for example, right? And so, I really expect and hope that the students capture some of that and some of the community testing. And then, from those improvements and from the content improvement, obviously work towards a better solution as the project moves on.
Thank you. Yeah, it is really exciting, and there's a lot there. I'm sure it'll be a lot of work for every entity involved, for sure. One other question kind of pertaining to my prior one. What has it been like to engage with students so far, just about this project coming together? I'm sure there's a lot of excitement there.
There is a lot of excitement, and I'm going to jump on that one. So we actually have not engaged the students yet.
Oh.
The process typically happens in the beginning of the semester where they start to tackle the project. The current ITO team is tackling some of the projects that were scoped as early as a year and a half ago. And so, as those projects start to wrap up, then we'll kind of transition the team. And this is really kind of under the advisors' direction, transition those student teams into working on this. But we've been working with the advisors. Robin and Kelly and I have been working together with some of our corporate sponsors to help define this project. And overall, I think the plan is there. It's the next step is execution.
Awesome, thank you. And then Robin, same question. What's it been like at the health department to just get notification that this project's going to go through? I'm sure there's a lot of excitement there.
Yeah, I mean, as everyone can imagine, we are quite busy at the health department these days with our COVID work. So I think, I think that it's something that we are very excited about. It's a little hard to focus because it's kind of this thing that's coming in the future, and we really are very immediately focused on the large needs that we have. But I do think that knowing that this was a priority and being able to work towards actual goals is always welcome, and something that we're excited about. So absolutely, we're excited to see things to lift off and be able to move forward with a project that we've been wanting to do for a few years now. So very excited.
Yeah, and then one thing I think that is super interesting is just the longevity of what could come from this project. Not only in the Keweenaw area, but I was wondering if either of you think that there's a possibility for a web service like this, assuming it comes together well and everything, to be replicated in other rural areas.
That was really the goal for us. Yeah. I mean, that was my vision originally. Like, could I build something? Could it broaden out to the UP? Could it broaden to, a rural community in, Nebraska? Is that possible? Could this be a prototype? I would absolutely love to see working towards solutions for our rural communities across the country, honestly.
And I'm glad you brought that up, Thomas. And I will absolutely credit Robin with the idea, because as soon as she said that, I thought to myself, absolutely, there is absolutely no reason that we couldn't create something that might be open source enough that any community could come up with it. And so that word open source is actually in the title of the official student project, right? And that's the intent.
Mm-hmm. It's really exciting for me to ask these questions and to hear too. Really exciting. So to wrap up our time, I'm going to ask both of you, what's one takeaway that you'd like others to know about this initiative, or just in general, any other final thoughts that you'd like to share with the audience?
I will go first. In general, we're very excited about this specific project. I really hope that the outcomes are really going to improve our community, in several different ways, right? And also improve the students' capabilities and their own experience while here at Michigan Tech, specifically from the program's point of view. I just want to make sure that everybody who watches this video has an understanding of what the enterprise program really is. It's very flexible and is very unique in the fact that it can tackle a lot of different problems from a wide variety of areas, right? And so if there's ever any interest in discussing the program itself or any specific project like this or any different idea, I would encourage people to get with me and we can, at least initiate the conversation and make that happen.
Thank you. And Robin?
Yeah, I would say if anyone listening feels, kind of called to this or feels like they have something to contribute to the project, certainly we're going to be really making a big effort to be reaching out to our community partners to get their input, to see how this might work best. We've made a lot of those initial contacts, like I said, from that kind of grassroots effort we did at the beginning of the pandemic. So certainly reaching out to myself or even Dr. Cam would be, great. We'd love to hear from you. The other piece I would just say is that to our community is that we're listening and that we do care and that we do want to find solutions to support all of us, pandemic or no pandemic. And just because the system seems broken doesn't mean we can't try to make changes in even small ways for the outcome of the good, I think. So that's kind of the big pieces for me that this project means. So.
Thank you. So I would like to thank both of you for joining me for this interview. I'm really fascinated by the story, and I think a lot of other people will be too. I think it's definitely a story that people will be grateful to hear, and it's going to be really interesting to see how everything unfolds come spring and beyond. For everyone who's listening, be sure to go check out all of our interviews with other change makers. To do this, just simply go to mtu.edu and enter Global and Community Engagement Conference into the search tab. Thank you again, Robin and Chris, and I hope our audience has a great day. Thank you.